She started hormone replacement therapy 8 months ago, mostly for the hot flashes and the sleep. 6 weeks in, she noticed something she hadn't expected. Her dentist, at a routine cleaning, mentioned that her gums looked calmer than they had at her last 2 visits. She hadn't changed her toothbrush, her flossing habit, or anything else about her routine. She just assumed it was a coincidence. It wasn't. If you're considering HRT, already taking it, or simply trying to understand everything it does and doesn't do, there's a good chance nobody has mentioned its connection to your mouth. Most conversations about hormone replacement therapy focus on hot flashes, bone density, mood, and heart health. All real and well documented. But there's a growing body of research specifically on what HRT does for your gums, your jawbone, and your risk of tooth loss. And it rarely makes it into the conversation you have with your doctor, and almost never comes up with your dentist either. In this video, we're going to walk through exactly what the research shows, the real findings, the limitations, what it does and doesn't mean for your decision, and the specific questions worth asking both your physician and your dentist. This isn't medical advice telling you what to do. It's the information that's often missing from the conversation, so you can walk into your next appointment better informed than most women are. Let's start with why your mouth is affected by this decision in the first place. Estrogen does far more in your body than regulate your reproductive cycle. It plays a direct role in bone metabolism throughout your entire skeleton, including your jawbone, the structure that literally holds your teeth in place. It also regulates collagen production in your gum tissue, blood flow to that tissue, and how your immune system responds to the bacteria that live in your mouth every single day. When estrogen declines during perimenopause and menopause, all of these systems are affected at once, which is part of why oral health problems tend to cluster around this life stage rather than emerging gradually and evenly over the decades. It helps to understand your mouth almost like a smaller version of your whole skeletal and immune system. The same estrogen receptors found in your hips and spine, the ones doctors talk about when they discuss osteoporosis risk, are also present in your jawbone and your gum tissue. So, when researchers talk about estrogen protecting bone density, that protection isn't limited to the bones you'd typically think of. Your jaw is part of that same system, just rarely part of that same conversation. This is the foundation for understanding what HRT research on the mouth is actually testing. Not whether hormones affect your teeth and gums, that part is well established, but whether replacing those hormones changes the outcome. That's a more specific, more useful question, and it's the one we're going to spend the rest of this video answering. Let's start with periodontitis, because it has the largest body of research behind it. Periodontitis, the more advanced and destructive form of gum disease that affects the bone supporting your teeth, becomes significantly more common after menopause. Unlike simple gingivitis, which is inflammation you can often reverse with better hygiene, periodontitis involves actual loss of the bone and connective tissue anchoring your teeth. And that loss doesn't grow back on its own. A large cohort study using 20 years of hospital data from nearly 1 million patients found that postmenopausal women had a meaningfully higher risk of developing periodontitis compared to premenopausal women, and that women receiving hormone replacement therapy showed a reduced risk compared to postmenopausal women who were not on HRT. A study of this size matters because smaller studies can be affected by chance findings in ways that large population-level data tends to smooth out. A separate case control study conducted in Saudi Arabia, involving over 370 postmenopausal women, found that women using HRT had a lower prevalence of periodontitis than those who weren't. Though the same study noted that HRT didn't significantly reduce the severity of periodontitis once it had already developed, and didn't show a significant effect on saliva levels in that particular sample. This distinction matters, and it's one that gets lost in a lot of oversimplified health content. The research suggests HRT may help prevent the disease from developing in the first place, more than it reverses damage that's already occurred. Prevention and treatment are two very different things, and this research speaks much more clearly to the first than the second. At the mechanistic level, meaning the actual biological why behind these patterns, a study using both human patients and an animal model found that HRT was associated with measurably higher bone mineral density in the jaw and better preservation of alveolar bone, which is the bone that directly surrounds and supports your teeth, compared to those not receiving HRT. Researchers proposed that estrogen's role in enhancing collagen synthesis, improving wound healing, and supporting healthy bone metabolism explains why HRT users in these studies tended to have better periodontal outcomes. This is the kind of study that helps confirm the why behind the population-level patterns seen in the larger cohort research. Older research points in the same direction, and it's worth noting because it shows this isn't a brand new or fringe finding. Estrogen replacement has been associated with reduced clinical attachment loss, a key measure dentists use to track how much support structure around a tooth has been lost over time, and with a lower risk of severe periodontitis when compared to women not using estrogen therapy. This connection has been studied in various forms for more than 2 decades. Here's where it's important to be precise, because oversimplifying this does you a disservice. And frankly, it's the kind of oversimplification that gives health content on the internet a bad name. This research shows an association between HRT and better periodontal outcomes. It does not mean HRT is a treatment for gum disease, and it does not mean every woman on HRT will avoid these problems entirely. Several of these studies are observational, meaning they show a pattern across large groups of people, not a guaranteed cause and effect for any one individual. Some studies found benefits specifically in preventing new disease, not in reversing existing damage. And study populations, HRT formulations, whether estrogen alone or combined with progesterone, oral versus transdermal, and dosages vary considerably across this research, meaning results don't automatically apply the same way to every type of hormone therapy or every woman's specific prescription. What the research does support clearly is this: estrogen plays a measurable biological role in the health of your gums and jawbone, and hormone replacement therapy is one of the few interventions that has actually been studied specifically for its effect on that relationship. Which, frankly, is more than can be said for most things marketed for gum health on store shelves. Now, let's talk about saliva, because this connects directly to something we've covered before on this channel. We've covered dry mouth in depth in previous videos, but it's directly relevant here, and the research on it adds an important layer to this conversation. One case control study found that postmenopausal women who began hormone replacement therapy showed a measurable rise in salivary estradiol levels and their self-reported dry mouth symptoms, including waking at night with a dry mouth, which the large majority of women in the study experienced before starting treatment, decreased significantly afterward. Other research on minor salivary gland function in postmenopausal women using low-dose estrogen found measurable differences in saliva output compared to women not using it, reinforcing that this isn't an isolated finding from a single study, but a pattern showing up across different research groups. That said, not every study agrees on every measure, and it's important that we don't cherry-pick the findings that make the tidiest story. The periodontal study we mentioned earlier from Saudi Arabia specifically did not find a significant effect of HRT on saliva levels in its sample. This is a genuinely active area of research, not a settled one-size-fits-all answer, and that nuance matters more to your actual decision-making than a falsely tidy conclusion would. There's one more piece of this worth covering: tooth loss itself, which is really the downstream, long-term consequence of everything we've discussed so far, because HRT supports bone density broadly, and jawbone density specifically affects how well your teeth stay anchored in place. Some research has looked directly at tooth retention over time. Studies on estrogen use in postmenopausal women have found associations with better tooth retention and higher oral bone height compared to non-users, consistent with the periodontal findings we already discussed, since tooth loss in this population is frequently not a sudden event, but a slow, downstream consequence of untreated periodontitis and bone loss working together over years, often without a woman noticing until a tooth is already loose. So, with all of this research in mind, what should you actually do with it? First, understand that this is not a reason to start HRT on its own. The decision to begin hormone replacement therapy involves your full medical history, your personal risk factors, including things like history of certain cancers, blood clots, and cardiovascular health, and a conversation with a physician who knows your complete health picture. Oral health benefits are a potential secondary consideration in that decision, not a primary reason to pursue or avoid treatment. Second, if you are already on HRT or seriously considering it, this is worth bringing up specifically with your dentist at your next visit. Most dental teams don't automatically ask about hormone therapy status as part of a routine intake, and most physicians don't automatically loop in dental considerations when discussing HRT. That means you may genuinely be the only person in the room connecting the two, which means saying it out loud, clearly, matters more than you'd expect. Third, regardless of your HRT status, the periodontal research is a clear signal that postmenopausal women benefit from more frequent periodontal monitoring, not less. If your dental visits have quietly become less frequent since your 40s, which happens to a lot of women once other health priorities take over, this is a reasonable moment to reconsider that, given what we now know about how quickly bone and tissue changes can progress in this life stage. Fourth, if you do bring this up with your dentist or physician, come with a few specific questions rather than a general comment. Ask your dentist whether they track attachment loss and bone levels at each visit, not just surface-level plaque. Ask your physician whether the specific type and route of HRT they're discussing with you has been studied for oral or bone effects, since, as we covered, not all formulations are researched equally. These specific questions tend to get more useful answers than a general, "Does this affect my teeth?" And fifth, know that HRT is not a substitute for the daily fundamentals. Every study we've covered examined HRT as one variable among many. None of them suggest that hormone therapy replaces consistent oral hygiene, professional cleanings, or the saliva-supporting habits we've discussed in earlier videos on this channel. The research shows HRT may tilt the odds in your favor over time. It doesn't rewrite them entirely on its own, and it was never studied as a standalone fix. The relationship between your hormones and your mouth is real, measurable, and still being actively researched, with new studies continuing to refine exactly how strong these effects are and for which women. What we know so far suggests that the conversation about hormone replacement therapy is bigger than hot flashes and sleep. And your mouth quietly deserves a seat at that table too. If this gave you something worth bringing to your next appointment, subscribe. This channel exists to connect the dots between what's happening in your body during midlife and the information that's often missing from the conversation. This channel is for educational purposes only and isn't a substitute for advice from your dentist or physician. Always talk to a healthcare professional before making decisions about your health.